Hey guys, Dr. Matt here. So I get a lot of questions about when one should follow up with their primary care once they get back home. Unfortunately, there's not a straightforward answer that I can give to everyone, so let me try to sum it up for you guys. If you take medications that you're trying to reduce in dosage or you're trying to get rid of altogether, for example, blood pressure medications, diabetes medications, those medications tend to need to be reduced even quicker than the weight starts coming off. So if you take 1 to 3 blood pressure medications, or if you're on both injectable medications for diabetes as well as medications by mouth for diabetes, you gotta understand that within 2 weeks to a month, the blood pressure tends to respond, and so too does the blood sugar tend to respond, both to the surgery itself as well as to the fact that you're eating a low carb diet. So in those patients, you gotta follow up 2 weeks, maybe a month at the latest with your primary care to make sure that you're not running into a problem with low blood sugar or blood pressure that has now normalized, and now you're treating normal blood pressure with medications causing your blood pressure to be too low. If you start noticing that you're feeling lightheaded or dizzy, that might be an indication that your blood pressure has now responded to the surgery, and therefore you're having low blood pressure, which is why you're feeling the way you're feeling. That would be an indication for you to see your primary care doctor sooner than later. If, on the other hand, you take no blood pressure medications, you're not on any diabetes medications, you're not taking much in the way of medications at all before surgery, you can wait until about 6 months after surgery to get in touch with your primary care so you can get the standard blood work that we would get, which includes evaluation of all your vitamins, minerals, and electrolytes to make sure that you're having a full complement of all the supplements that you need on board and that you're absorbing everything as we would expect. You guys should all receive a call from the office checking up with you within about a week after surgery to make sure everything is going according to plan, okay? On top of that, if at any point you find that the weight isn't coming off as you would expect, which in my mind means you're losing at least 10 pounds a month for the first 6 months, then I would strongly recommend you getting in touch with our dietitian to figure out, are you eating too much? Are you eating too little? Or are you eating the wrong complement of protein, fat, carbohydrates, okay? Trust me on this, the first 6 months is critical. If you're not down 30 pounds from the day of surgery, 3 months out, you should really get in touch with Alex to make sure that you understand why things are coming along a little slower than what we would expect. And remember, we're always here for you. This is not an easy process. There's a lot of complexity to being successful after the sleeve, so lean on us as your resource to be successful. Don't just get the surgery and disappear and expect the magic to happen. Help us tell you how to use the surgery well and make sure that you're doing it to the best of your ability so you get all the weight off that you seek to get.